times patients come to the OPD with the complaint of headaches, of course, but they also ask for getting a head CT scan done. Well, I asked them why they want a CT scan of the head if they're having headache. The only concern that is they have is having the fear of having a brain tumor. Well, now I can explain you what are the different kinds of symptoms that can help you differentiate between a normal headache and a headache due to a tumor, because it is very important for you to know that not every headache is due to tumor, and not every brain tumor can lead to headaches. We'll present with some of these symptoms that I'm going to list now. They may have a morning headaches. I mean to say that as soon as they get up in the morning, they feel heaviness in their head, they feel headache, literal headache. Also, along with headache, they may also experience having a sensation of vomiting, or they may even throw up. Okay, and this could be happening for a couple of days, a couple of weeks. Now, other than that, a patient who has a tumor, potentially has a tumor in the brain, could also experience some deficits like weakness in the arms or legs, or weakness in the face. Could be a slurring of speech sometimes, on and off pattern of this kind of deficits anywhere in the body. Okay, weaknesses overall, I can say. Other than that, they can also have some issues with vision if they can't see properly, or they have some blurring of vision, something like that, some hearing issues. So it all depends on at which point is the tumor, which location, because depending on the location, the patient will show the symptoms according to the location of the tumor in the brain. Okay, and other than that, tumor can also be painless. There will be no pain, and the pain, if there is a pain, it could be potentially in the back, or sometimes it can be throughout the head. So usually we can't say exactly if it's a tumor or not. So in that case, if the patient demands for a CT scan of head, it's a valid point. Okay, you understand that? If you don't have any of these listed symptoms of a brain tumor, believe me, you don't have a brain tumor. Your headache is just a simple type of headache, which is most probably a tension type of headache. A patient who has symptoms of tumor or just headache, they can present with just having seizures. Okay, if they don't have headache, they can just have seizures, and that could be potentially a brain tumor. It includes all the age groups, including the kids. Okay, so this is also very important sign and symptom of having a tumor in your brain, with or without headache. There is one more condition in which the patient can have all the symptoms and signs of having a brain tumor. Okay, but even after doing a CT scan, we don't find a tumor in their brain. Well, that condition is most likely called as Pseudo Tumor cerebri. Now, I don't have that much time to explain this condition in more detail. I'll be doing it in a separate video, but there are such conditions as well. So not necessarily you have a tumor and you have a headache.